So, good afternoon. Thank you all for joining us for this special edition of Game Changers Media Network. I am here today with the owner of GEL Financial Services and health advisor, Ms. Gale Lawrance. Thank you for being here, Ms. Gale.
Thank you for having me.
We certainly appreciate your time, especially everything that's going on right now related to health and the way our government is changing things. So many people starting entrepreneurship, so many people dealing with a multitude of things. We really want to make sure that we're in position to have our families receive the best services. And I understand that you're the person for that.
I hope so.
So we spoke prior to our interview and I was asking you a lot. I am a person that always wants to know someone's history and wants to understand how long they've been in the industry and where their knowledge comes from. So I understand that you've been in the industry for about 22 years. Can you tell us a little bit about that process and you getting into the industry and what's that been like?
Yeah, I've been doing in the insurance industry for 22 years. Prior to that, I was actually working for the insurance commissioner. I was brought in to automate the office, take them from back in the day typewriters to computers. And after that was downsized, I was just enjoying my 401k and unemployment. And then it said, well, you got to get a job. What you want to do? And I just said, oh, I'll be an insurance agent. I got inundated with all types of things. So I just went and took the test, passed it, and the rest is history. I enjoy what I'm doing.
That's wonderful. So tell us more. What exactly do you do? I know you do multiple things, but what's the main service that GEL offers?
Okay, in this season, the main thing that we're offering is health insurance because the GEL Financial Services, but GEL Health Advisors is the health division of GEL Financial Services. And what we try to do is, in addition to just offering service, we want to educate the public because a lot of people have access to things that they don't know that they have. And the reason why we know, because we have to do so much certification just to be able to offer that. For example, a lot of people qualify for health insurance and don't even realize it. And by the time they come to me, they just miss, like today, somebody missed the deadline by 2 days. So now they have to wait to open enrollment in November. But we like to educate the people, and then we like to go that extra mile to find things that people need. If they say, I need certain things, well, we're going to go try to find that for them. If people don't qualify for health insurance, we're going to find a source that can get them some type of assistance until we can get them in a plan.
I understand. So you can basically help anyone that doesn't have insurance offered through their current employer, unless it's too expensive. Is that correct?
Yes, and I won't even say unless it's too expensive. We say that we can insure anybody from age 0 to 99. And basically, we can because after 99, they're going to be taken care of anyway. But we can insure like from 0 to 64, we have the affordable health care. And if that's out of season or we can't get you into that, we have other plans that we can put you in. And we know how to go to different venues to try to get assistance. And then for those people that are 65 and older like myself, or people that have certain chronic diseases or disability, we have Medicare, and there's a lot of different avenues for Medicare. And we don't just try to get them in Medicare, we see what their needs are, and then we try to fit them to a plan that's best for them.
So each health plan really is specific towards your needs, and that's what we should be looking for when searching for health plans, not just a basic plan. Is that correct?
I have twin, and twin, they even have different needs. Everybody's need is about as different as your fingerprints.
Oh, wow. Okay, so I didn't know that. So that's awesome to know. And I know people that are listening are probably wondering if they have the type of insurance that they need to cover them specifically. So, do you help people who are small business owners? What should someone who's a small business owner be looking at, or why should they be looking for your services?
Because we can help small business owner either get a small business plan or just depend on where their business is. We can find out if they would be better off with a small business plan or individual plan.
Okay.
Sometime it just depends on where the business is, and we'll find that out. It might be better for us to go in and give everybody an individual plan that would help their workers better than just a small business plan. So we do a needs analysis first, see what your needs are first, and then we make recommendation. But together we come together and design a plan. But the customer has the last say. We're just there to assist.
So, and that's good that there's at least a process that goes with it.
Mhm.
Now, as a small business owner, I know a lot of us often are we, kind of basing our insurance rates off of our personal income? Is it based off of the income of the business? Because I know I hear a lot of people in my circle that are business owners and they choose not to have health insurance because they make too much money as a business owner, or the health insurance is way too expensive. So are you able to assist someone kind of in that situation as well?
Yes, and a lot of people think, it's too high, and maybe it might be, but for those people, there still is an option. I say something is better than nothing. They can get an individual plan that's what's called a bronze plan. It has a high deductible, but all your preventive don't cost you anything. It's zero. You go in to get
Hmm.
all your preventive, the things that women have to have, men have to have, all your preventive, your diabetic tests, all of those things are cost zero. And if you get in an accident or something, or you have, anything could come up, you might have a high deductible, but you do have a real health plan that
Right.
that you can go in. As long as you have that card, they'll work with you on it. It might be a bronze plan that won't, cost as much as a plan that has a low deductible, but still you have something, and you have a lot of services that you can get that cost, like I said, it costs you nothing. So we work with the small groups, we work with the individuals, and we come up with a recommendation. We don't just go in and say, oh, you're realtor, we're going to give you this. It doesn't work like that. It's an individual thing.
Okay. And for someone who is an individual or a small business owner, is there a fee to use your services or to speak with you in regards to our
No,
options for health insurance?
no, we do not charge a fee for what we
Oh, wow.
do. And if everything that we do, we don't get paid for it, but it's
Yeah.
just part of our service. Our theme is we are insurance agent with a servant's heart, and that's how
Mhm.
we approach all of our business. And I would think if we take care of the customer, we're going to be taking care of it. But no, nobody ever pays us. The insurance companies pay us.
Okay. That's great, because I know a lot of people, whenever you start talking about insurance or services or
Mm-hmm.
anything, people automatically assume that there's a cost associated with it, and it
Mm-hmm.
deters them from reaching out. So everyone listening, Ms. Gale has said that there's no charge. The insurance company will actually pay. So utilizing her services gives you an opportunity to get that expert knowledge and find something that's tailored to fit your needs, which may be different from someone else or your small business needs.
Correct.
Um, so, Ms. Gale, one of the things you mentioned previously is preventative services. I don't think we talk about how important that is, especially for people of color,
Mm-hmm.
making sure that we're having and getting those preventative checks to kind of get ahead of things. Are most insurance companies offering that, or is this something that just started?
No, they have been offering it actually since the Affordable Care Act started.
Oh, wow.
in 2014 when I first started doing it. Preventive, and with the Medicare, always have been preventive, because if you can prevent something from happening, it will cost less. It will cost less money-wise, and it'll cost less health-wise also. For example, if you're diabetic, if we can catch it at an early stage, we can, first of all, it wouldn't cost that much, wouldn't cost that much to maintain it. A doctor would much rather treat your feet and get you diabetic shoes and things like
Yes.
that, than for you to go and let it set up and it gets so bad, and it's first you might end up losing your foot or
Yeah, it's crazy.
it just costs more for that.
Right.
So preventive is key. With the health insurance is you will find out that the health insurance, especially here in our states, but in Georgia mainly where I work in some other states too, but mainly in Georgia, if you are late getting your medication, that insurance company is going to call you, especially if you're on maintenance medicine like high blood pressure medicine, and they see
Yeah.
that you're not taking your medicine. The insurance company will call you
Oh,
and
wow.
find out why. Do we need to have it delivered to your house? So is the thing. These are the things I wish the media would be letting people know, because
Mm,
our health is our wealth.
that's right. So, what are some other preventative tests or different things that we all should be trying to make sure that we're doing annually that's free as a part of our insurance?
Okay, one thing you just said, your annual checkup, not your annual physical, but your
Okay.
annual checkup. That
Wait,
that
they're
that
different?
yeah, they are different. The
Oh man.
physical is gonna cost you money, but
Right.
annual checkup, they're gonna check your,
Right.
your diabetes and weight, everything. They're gonna check everything, and they'll discover things that will help you. And then for example, even if you want to, if you're overweight, there are programs there for that. There are programs in the preventive if you want to stop smoking, if you
Mm,
have to have cancer, different types of tests to check for cancer, things like that. Especially a lot like the diabetes, high blood pressure, a lot of preventive things are out there that really don't cost you anything. Your bone mass density, all of these tests, all of this falls on the preventive health. And everybody, if you just go in and get that, no cost annual checkup,
yeah.
it keeps us healthy. And then for people that are, for example, I use diabetes because that's a lot in our area. You're going to the doctor every 3 months, and they're checking up on everything. This keeps us alive, because if that gets out of whack, then there goes our kidney, there goes our liver, and a whole lot of other things.
That's right. So we've talked about a little bit about the preventative services that are offered with the insurances by law.
Mm-hmm.
Um, what about children? How do children play into the insurance? For many of us, we have kids, and whether you're a small business owner or just a single parent, how are children insured, and how does that affect us?
Oh, the children are very much taken care of. When we do the Affordable Care Act, sometime if a parent, everybody can get it, but some people can get subsidy. That means
Okay.
it's similar when you work on your job. You pay a part and the job pay a part. With subsidy, if you qualify for it, you pay part of it, and then you get assistance paying the other part. If you have sometime when we go in and do it, it will give you, the children might go to CHIP, or the children might be on this plan, but every child on this plan has to have a dental plan. It's just
Okay.
baked in there. I don't care if you're on the Affordable Care Act, the children get the dental plan. And there are a lot of services. So when I said from 0 to 99, literally
Zero.
from 0
Zero to
to
99.
99, yes. Children are very much taken care of.
Understandable. So, um, now, when we start progressing, and I know one of the biggest things we talked about is for the people in our community that are transitioning, whether it's they've had some type of injury or illness, they're over 65 and just needing a little bit of assistance, they're getting out of the hospital. There's so many different specific services that the insurance companies help. And for some of us who don't have experience in that, or our parents are at that stage, or grandparents are at that stage where they're receiving hospice care or they're receiving extra care, sometimes we don't know what services are available to us. So could you kind of tell us some of those services that are available for us, especially as it pertains to when people get out of the hospital, and things that just make your quality of living a little bit better?
Yes, and each year I think it gets better, especially with the Medicare, because that's where my heart is. I love working with my Medicare clients, and we see what they need. For example, if you go into the hospital, when you come out, you're gonna get chef-prepared meals
Mm,
sent to your home, not
yes.
the frozen stuff, we
Yes.
go in. No, these are
Right.
chef prepared meals, and they are sent to you. Might be different days to plan, depending on what plan you're on, but those things are there for you. Some of if you're on Medicare, and you might have a few more illnesses than anyone else, well, we have what's called managed care, and we have a
Mm,
care coordinator that will come in and make sure that even though the doctor's doing these things, will come in and make sure that you're taken care of. There are some plans that even the doctors now making house calls.
oh, wow.
They're making
So
house
not the
calls.
nurse, the
Not the
actual
nurse, the
doctor.
actual doctor
Oh,
making
wow.
house call. It just depends on what's your care service. And then there are some people, as we get older, just fall in certain situations, we might need more assistance. We might need someone to come into the house maybe 2 or 3 hours a day. Well, we work with the care coordinator and get those things for them. And hospice is real good. Most people, when they hear the word hospice, they think, oh,
Death.
but no, it's not. Not all the time. There are some people go on hospice and come right off of hospice.
Mm,
So hospice, and it's included, is included with Medicare, and it doesn't cost anything extra. And it just depends on what your need is. And hospice can be taken care of right at home in your house. If you need a hospital bed, they'll bring that in. People come in and take care of you in and out all day. But they're just all kind. I'm not going to think of 100 different
no, you're
things
fine.
when we
Right.
when we finish, but it's there for them. For example, again, going back to somebody that's diabetic, they have a scale that you can step on, and if it turns a certain color, that means you call 911.
Wow. How
That's
advanced
part.
is that?
Yeah, that's part of, and that's been around for a long time, but most people don't
Wow.
realize it's there. All of these things are there. Testing supplies, hearing aids, even on the Medicare plans. A lot of the plans include where you get your dental work done, go even beyond just getting cleanings and fillings. Some of them go as far as dentures. That funds are there to pay for your denture, just depending on what plan you have. Your eyeglasses, the help. I fallen, I can't get up, those type things. That's there. And for people like me that don't use mine, I really need to use it. Maybe I'll start tomorrow. But
Maybe tomorrow.
we have fitness programs
Okay.
that you can go to 5 gyms a day if you want to. It's
Wow.
all included in your plan. No extra cost.
And these are things that people are not aware of at all.
And not
So,
aware of. And that's why we are trying to tell people. And another thing I want to make sure that people realize on Medicare, they say, well, I don't need this, I don't need that. There's a time limit for getting things done. And if you don't do these things in a timely manner, you could have a penalty for the rest of your life.
wow.
Yeah, so that's why education is key to us. It's very key to us.
Well, one of the things I heard you say previously is we have not because we ask not.
Mhm.
And that really resonated with me because there's a lot of things that we need, especially as it pertains to our health.
Mhm.
So, we appreciate you for sharing your knowledge and, educating us because that is important. And it's important for us to understand how these things impact us, and they impact our business, they impact our everyday life, and those around us. So if someone wants to connect with you today, if they want to reach out to you to get more information, to learn, how can they go about doing that? With COVID and everything, I know things have changed. How are
Mhm.
you meeting with clients, and kind of what is that process like for someone that's interested in working with you?
They can always call. I have a cell phone. I have a voicemail. The best way is to call my voicemail, which immediately gets in touch with me, but you can leave a detailed message. That number is 817-381-1500. Um, what the way that I meet with clients is through Zoom, over the phone. And sometimes if I have clients that don't have email address, because most of the things we can just email back and forth, or we can
Mhm.
text back and forth. We have the technology in place to do that. But if I don't, then I use regular mail. I will
Yeah.
get all of your information. If I need to get your signature that way, I would mail it to you, have it in a package where all you have to do is sign it, send it back to me, and I get you signed up.
Well,
But
that sounds like a easy process. So
it
it's
is.
not painful. For some
Mm-mm.
reason, everyone has this association with dealing with insurance and anything that has to do with medical, as if it's a strenuous process or it's a difficult process. So,
Mm-mm.
um, to anyone listening, you guys are more than welcome to contact Ms. Gale. The process is quick and easy. You can do it over Zoom, over the phone. She can mail you out paperwork. And this is the time to really focus on making sure that we have our health in check.
Mm-hmm.
Ms. Gale, before we wrap up, is there anything else you want to tell the audience?
Just tell everybody that these things are available to you. Just call and ask. Ask. We have not because we ask not. So ask, and the very question that you might ask might be something that somebody else need. And we just want to get the word out that people have these things, and it makes me feel good when someone says, I'm glad I got on this plan. I've had someone to get on the plan, and 2 days later they end up having a heart attack. Well, they had the insurance to take care of it. And these are the things that make us feel good. So let's just help me get the word out that people, it's available to you. We can't find you the exact plan. We will find you something. And if we can't, we always go the extra mile. We go the extra mile, even with our Medicare people, to help them get. Sometime we try to get their costs down to as close to zero as possible.
Oh,
So
wow.
this is just something that my group, GL Health Advisors, that we just love doing for our
Right.
clients.
There's definitely passion there, and that's what you need when you're in this type of industry. So are you guys on social media at all? Where can we find you on social media?
GEL Health Advisors on social media, GEL Insure on social media, uh, GELHealthAdvisors.com, our website. So GEL Health Advisors everywhere.
Right.
Yeah,
So on all social media platforms, GEL Health Advisors.
mm-hmm,
That's also the website as well, www.gelhealthadvisors.com.
mm-hmm,
Make sure that you take the time to reach out to Miss Gale and see what your options are. We definitely appreciate you for educating us, for informing us. I ask that anyone listening to this, share it with someone that you know. You never know who is underinsured or who is uninsured and may need the resources at no charge.
no charge.
At no charge. I
No
mean, you
charge.
had me at the chef meals, so I'm already
Okay.
looking like, let me put that on my tab for later. So I, again, can't thank you enough on behalf of Game Changers for sitting down and having this discussion. And we will share your contact information as well. Thank you everyone for joining us today and learning a little bit more about health services and health options for you. My name is Shay Dixon, and I'm with Game Changers Media Network. And thank you for tuning in.
Thank you.